On 4th February, there is a Cancer Day. Why do we celebrate it, and why is it necessary that we have to celebrate it?
We don't celebrate the cancer, we celebrate the survivorship of cancer.
So these days we are hearing laser technology, immunotherapy, and there is massive drastic changes in cancer, treatments and all.
See, earlier there was not many treatment options available. Now we have a basket.
These days we are hearing about last mile in cancer. What does that mean?
Unfortunately, throughout the world, cancer treatment is mostly focused on cities, big cities, metro cities. But the villages, the small towns, they are neglected.
And it definitely damages the other parts too.
See, when we're talking about chemotherapy, hair fall is something which people are really scared of. And that usually does not happen with immunotherapy, and that gives a lot of edge. And the people tolerate immunotherapy much better than chemotherapy.
No hype, no fear, just honest health conversations. Hi, I'm Dr. Manasa Reddy. Today we have a really special guest with us, Dr. Debnarayan Dutta Garu, Senior Consultant Radio Oncologist. Let's welcome him. Hello, sir.
Hello.
How are you?
I'm fine.
On 4th February, there is a Cancer Day. Why do we celebrate it, and why is it necessary that we have to celebrate it? Only because of the reason of awareness, or anything behind any reason?
We don't celebrate the cancer, we celebrate the survivorship of cancer. See, that is what the all cancer is all about. Means it is the conquerors who have defeated the cancer. We celebrate it so that we give hope to a lot of people who are struggling to get the treatment done and getting through the treatment and the process during that time. So it gives a lot of immense support to the system, the doctors, the caregivers, the support people who are helping the conquerors to achieve what they have achieved and defeated the cancer.
Generally, people think it's just an awareness day. So we have many things behind it.
It is not. It is definitely an awareness thing to understand that cancer is conquerable, and those who have conquered, they actually can tell their stories that how they have conquered and what they have gone through, and they have gone through a difficult phase, and then ultimately they have conquered the disease.
Okay, so these days we are hearing laser technology, immunotherapy, and there is massive drastic changes in cancer, treatments and all, the diagnosis. So please tell me about the advancements.
See, earlier there was not many treatment options available. Now we have a basket of
Yeah,
treatment, and that is
multiple
actually
options.
multiple options. And that is has given us huge amount of opportunity to treat patients which is the good for the patients. Like immunotherapy has come in a big way, targeted therapies has come in a big way. In radiation therapy only, there are so many things that has come up, like proton therapy, that MR-Linac, cyber which are more precise kind of treatment, which was not there before. And in surgery also, there are non-invasive surgeries, keyhole surgeries, robotic surgery. So we have a lot of
Multiple, yeah.
options. Basically, what the advancement has happened in mechanics, in electronics, in all computer IT techniques, that has come into medical field as well.
So we hear these days we are hearing about last mile in cancer. What does that mean?
See, unfortunately, throughout the world, cancer treatment is mostly focused on cities, big cities, metro cities. But the villages, the small towns, they are neglected. And that is where the most of the cancer patients are. And they are not diagnosed, they are not treated on time, and the outcome is not that great because they are not got the treatment they are supposed to get.
Firstly, they're not even aware of it.
Not even aware of the disease, and they don't know where to go. So for someone who is from a village, a small town, to come to a metro city and get the doctor and get the treatment done is a real challenge. And that is the real challenge, and where this 4th February awareness can come into the picture to improve the last mile. Means in a small towns, small villages also, at least the awareness, the screening, the detection should be there for cancer.
We just spoke about last mile. So what is about it? You wanted to reach, give a massive awareness up to the villages.
See, now last mile reach means to allow those patients to avail the same kind of treatment, same kind of facility what the metro city people are getting. So means you may not able to give the high-end treatment there, like radiation therapy or robotic surgery, but you can able to have a diagnosis and allow them to come to the cities and get the treatment done. So last mile reach means allowing those patients to have the same treatment as a someone in the metro. Like if someone is in Hyderabad, they are allowed to have a proper diagnosis and proper treatment on time. So why not someone from the village, a small town, also get the same opportunity? That is what the last mile reach is all about.
So how is it done, so actually?
See, mostly it is done by screening, by cancer detection centers, like involving the PHCs in small cities, small hospitals also, and helping to have a cancer detection or cancer diagnosis uh, facilities, not only in the cities but in villages and small towns as well. That is what the last mile reach is all about.
So what do you mean by a best practice in cancer?
See, now someone from Europe or US, if they whatever treatment they are able to get from India, why not getting the same treatment? That is called the best practice. Means whatever is someone in any part of the world gets should be offered, or should be the opportunity should be given to
True.
take that treatment. That is called the best practice. Now, like given a small example, that in brain metastasis, if it is a patient is from Europe or US, they will never get whole brain radiation. They'll always get radiosurgery. That is the standard of care now. But unfortunately, in Indian subcontinent, 95% of the brain metastasis patients still get whole brain radiation. Only 5% because the availability of resources, awareness is not there. So then the best practice is not being practiced
True.
in the clinical
India,
sense.
yeah.
So that is where the best practice should come in. So whatever is someone in from Europe or US or any big places where all the facilities are available, they get the treatment. Same treatment should be given to all. Opportunity should be given to all people from India. We are not anyway. Our life is not inferior to anywhere from the US or on the Western
So
countries.
are all those treatments available here with us in Yashoda?
Yes. Now that is where the Yashoda Hospital comes into the picture. That it is not about the last mile reach alone. When there are specific, very high-end or sophisticated kind of treatment which is required to improve the quality of life and improve survival, that should be available, and that cannot be available in all places, and there has to be center of excellence for that. That needs expertise, that needs equipments, and that is where the tertiary centers come into the picture. And we do have the MR-Linac kind of facility in radiation oncology, which gives a best kind of radiations and more focused kind of treatment. And that is where
Precise,
that
very
is
precise
very
treatment.
precise kind
Yeah.
of treatment. So if someone in Europe or US get a brain metastasis or a prostate cancer or something like a meningioma or acoustic schwannoma, those are benign conditions. They are expected to live long. They are treated with very precise kind of treatment like MR-Linac. Unfortunately, in India still there are not many facilities, but fortunately we
Yeah,
have this
yeah. Now
facility
it
now,
is.
and we can avail this best practice what is available in Europe.
Is it a bit costly than compared to others?
See now the costly
Treatment
is
medical is only costlier, but
me see there are sometimes cost can be of different kinds. Like it is a treatment cost, there is the wage loss. Like for MR-Linac kind, we treat in 1 to 5 days only. We don't need to stay for 30 days. So if you add all the cost of staying for 6 weeks out of resources and pay loss and the cost for staying, if you consider all those things, then 5 days treatment and 30 days treatment may not be that difference in terms of cost. Also, one more factor is the quality of life. Means sometimes what happens if you are treating with a little old kind of technology where the toxicities are there are cost and quality of life deteriorations. That also has a cost. So if you consider that cost, then these high-end treatments are much more cost effective than consider to the
so
old kind of
advanced
treatment.
treatments are helping in quality of life too.
Yes, advanced technology is trying to treat the patients early. They can go back to their work early and finish the treatment on short time, and acute toxicities are much less. So that gives a lot of edge, and the cost factor is smudged when we
Comparative,
take
yeah.
all those things factors into account.
So let's talk about immunotherapy.
Yeah.
What is it, and are there only targeted patients, and how is it done?
See now if you see why we all have cancer cells daily, and they are not getting expressed, they are being killed, and they are killed because of our immune system. So if you are able to boost up our immune system, then actually we can take care of the cancer as well. So that with that concept, the immunotherapy has come into the picture. We are trying to boost our immunity with some medicines, and that is taking care of the cancer cells. So that is the ideal, because our body is taking care, body is fighting the cancer cells as a foreign body and taking care of that. Last 10 years or a decade, there's so much of studies has come out, and now in many situations there are level 1 evidence of immunotherapy to be used in cancer, and slowly maybe in a decade later, chemotherapy is going to be obsolete and immunotherapy is going to take that place, and then immunotherapy is much less toxic and more effective, and the acceptability of immunotherapy is much better than the chemotherapy.
Yeah, actually, like, the patients and the normal people always used to have their myth, like,
Yes,
chemotherapy means definitely we
yes,
have
yes,
side effects,
yes,
and it
yes,
definitely damages the other
yes,
parts too.
yes, yes,
So I guess with this immunotherapy,
yes,
it will be like, improvement of quality of life
yes,
and all will be much
yes,
more easier to everyone.
yes, yes. So let's see, when we're talking about chemotherapy, hair fall is something which people are really scared of, and that usually does not happen with immunotherapy, and that gives a lot of edge, and the people tolerate immunotherapy much better than chemotherapy. And immunotherapy is much more focused kind of approach, so the outcome has shown to be better. So many studies are happening, and so many immunotherapy agents are coming, and it is coming in a regular basis. Newer agents are coming which are superior than the older one, less toxic and more effective immunotherapies are coming, and hopefully in a decade later, as I told, they will take up and replace mostly chemotherapies, which is the conventional chemotherapy is what we practice now.
Is it really painful, sir? Chemotherapy was painful.
Yes, yes.
What about the immunotherapy?
Immunotherapy is not that painful. It has its own issues, because sometimes the body react to immunotherapy, and there are some hypersensitivity reactions that happens. But that is for a very small proportion of patients, and advanced, more second generation, third generations, more advanced generation of immunotherapies are much safer, and the side effects are much lesser
Okay, comparative to
compared to
others.
the older
Okay.
generations. Yeah.
So, are there any, patient selection is also important for immunotherapy?
Yes. See, now what has happened with immunotherapy, like this MR-Linac kind or radiosurgery, and immunotherapy can be clubbed. How it happens? This immunotherapy potentiates the effect of radiosurgery or radiotherapy, and radiotherapy potentiates the effect of immunotherapy. They
Okay.
work in tandem.
Ha, ha, ha.
So
Teamwork
slowly,
is going.
yes, slowly, not only chemotherapy or immunotherapy or radiosurgery, it is given in together to improve the. So 1 plus 1 is not 2, more than 2. That's what is happening, and now the most of the studies are happening with that intent only, so that the immunotherapy plus radiosurgery, radiation, and helping to improve the survival, the response rate, and reducing the quality of life, improving the quality of life, and preserving the quality of life as best as possible.
Tell me about radiation oncologist. How is it different from normal oncologist to radio?
See, radiation oncology is a specialized form of oncology where we treat with radiation therapy. And to be honest, if you consider all the oncologies, medical oncology, radiation oncology, surgical oncology, 70% of patients need radiation therapy at some point of time. And radiotherapy is one of the most cost effective way of treating cancer, because either there's a metastasis or primary disease. Radiation therapy is works in the most of the situations. So that is why the radiation therapy stands out, and it becomes, though if you consider chemotherapy and surgery, radiotherapy is the newest branch. It is only 100 years which is there, and modern radiation therapy is only 30-40 years old with Linac and all facilities here. But it has improved so much with these development of technologies and ITs and computers. So now it has taken up on the main modality of treatment in cancer.
So, as it is a part of you, like as you said, MR-Linac, what does it mean?
See, now most of the time on all radiation LINAC, linear accelerators, we used to use CT scan. But with CT scan, we cannot see soft tissue. That is where and our tumor most of the time stays in the soft tissue only. and that we miss. And that is the main drawback of we're not able to see it well during treatment. That is where the MR-Linac has come into the picture, that we can see the lesions during treatment. And if there's a shrink in size, position change, we can adapt and treat it. So in the form of true adaptive radiation is MR-Linac kind, because where you can see the lesions during the treatment, adapt it accordingly, plan it based on the shrink of the tumor. That actually gives a lot of edge and confidence that you are treating. So in MR-Linac, we have a fluoro. MR fluoro means during treatment, there's MR-Linac is going on. And we can see a real-time imaging. That is not possible in any other technology. And that is given a huge edge that we can see the lesions.
It is
well.
making treatment very accessible and easier.
More accessible and more confident that we are
Okay.
treating the right place.
Okay. So tell me about proton beam therapy.
See, like MR-Linac, proton beam therapy is also a newer development that has happened. And proton beam therapy works in a different mode. Like in linear accelerators, what we do, there is a small dose leakage. Means we target the organ where we are supposed to treat the PTVs, where the tumor, where we want to give a very high dose of radiations. There is a small dose spill here and there happens, and that sometimes causes toxicity. With proton beam therapies, we are focusing that there should not be any exit dose. Means the dose should be confined only to the target, where so the small dose spill is less. Mostly for pediatric patients, for patients where we need to give very high dose of radiations, where proton beam therapy is really useful. For now, the standard of care of using proton is for mostly for pediatric patients, skull-based tumors, chordomas, where normal radiation is not that useful because we cannot give that dose. That is where the proton beam therapy also is useful.
Okay. Most common cases, what do you see like in almost like a decade of experience, like 16 to 18 years of experience, who are most prone to cancers, or who are the patients, like youngsters or elders, and what is the most common cause?
It is extremely difficult to tell the cause because most of the time we don't know the
Yeah,
cause.
multifactorial.
But it has to be something with genetics, mutations that happens, and mutation happens with environment, pollutions, and basically the environmental pollutions are the most common cause of
Lifestyle
increase in
changes.
lifestyle changes, cause of cancer.
Tell me about what are the indications for MR-Linac.
MR-Linac is something which is like a radiosurgery tool, where we can see the lesions well and treat with very high dose of radiations. So small volume disease are actually ideal case for MR-Linac, like
Okay.
brain tumors, benign brain tumors like meningiomas, acoustics, craniopharyngiomas, then brain metastasis, where MRI is really useful to see the lesions well and treat. In head and neck, we can see the shrink and the tumor and target and treat it well and see. Liver tumors are not seen in CT scan, where the MRI is very important, where the MR-Linac plays. So 50% of throughout the world, MR-Linac cases are gastrointestinal, liver, pancreas, duodenum, where we can see it well with MR-Linac, target it well, and treat with very high dose of radiations. So liver tumors, portal vein thrombosis, pancreatic tumors are indications. Prostate cancers are really seen well with MRI, and treat in 5 days, not in 30-35 days. So that is a very good indication for MR-Linac practice. And sometimes the metastasis, spine metastasis, where we can see the spinal cord also and the vertebral body also, and treat in a very structured manner in 24 gray in 2 fractions, 2 days only treatment. That is possible with MR-Linac in a very appropriate manner, trying to save the spinal cord.
How does it differentiate from, again, proton beam therapy?
See, proton beam therapy is a standard kind of treatment, which is mostly for a long course of treatment, means 6 weeks of radiations, but trying to reduce the low dose spill and reduce the second malignancies, which is associated with radiation treatment. So for pediatric patients who are expected to live long than more than 20, 25, 30 years, that proton beam therapy is really useful. Like spinal cord tumors, or like cranospinal radiations, we call it. So CSI, and sometimes the pediatric brain tumors, their proton beam therapy is really useful because these patients are going to live long, and these patients, the other organs should not get the small low dose and cause long-term effect. Chordomas and chordosarcomas, where you need very high dose, 80 grade, 85 grade dose, you need to have a control. That is where the proton beam therapy is really useful.
So old age people are not given this therapy.
See, for old age people, proton beam therapy, I'm not sure, but because
Okay.
the second
Age, yeah.
malignancy genes may not be there, we should treat in a shorter course, not a 30 days, for maybe 5 days or 10 days of treatment. That is where maybe the MR-Linac will play big role, because we can all reduce surgery, cyberknife kind, where we can treat in a very short course and a very precise kind of radiation without reducing the volume and reducing the side effect as best as possible.
Worked in different places of
Yeah.
India, different parts
Yes.
of India,
Yes.
in West Bengal and Kerala and many where, I guess even in Tata Memorial
Yes.
also.
Yes. Yes. Yes.
So how is your experience and what are the challenges you faced?
See, all places have a different way, different mindsets are
Yeah.
different, and the approach is different, and the treatment parameters are different. See, in West Bengal, people go out. You know that people are coming out of that place and getting treatment everywhere else. But in Kerala, people believe their own doctors and get the treatment done there in Kerala only. In Tata Memorial, most of the things are very protocol based treatment, not an individual based treatment. So everywhere has its own challenges, and but what I understood that ideally patients should be treated in their own native place, especially cancers, because they need a long-term treatment, long-term follow-ups, and they have small issues which need to be corrected. So that is where the I think the Kerala model is a real model where the patients are treated in their native places, and and treatment can be done in morphine is available in PHCs. Okay, so there are small centers where the palliative cares are done. Those patients are treated. Only there are centers like Amrita Institute or something where the high-end treatments are available, and I think that is the best model. I feel should be we all should try to follow.
Yeah, yeah. So how you wanted, like how from your and you're helping, like to get the villages awareness and how you want to give the treatment to the villages.
See, it is extremely difficult to avail all the facilities in a village. It is a practical problem because it is we need to get the facilities there and ensure that they have the functional. Need the manpower, there are staff to train staff to run them appropriately. It is not. It is challenging. Ideally, in the villages, there should be proper screening camp, and they should be diagnosed early. And when they are diagnosed early, they should be shifted to a place where they can be treated in early manner. That model is the best model I feel for villages. And slowly, maybe in two-tier cities and small towns also, the facility should be available. Otherwise, metro cities are getting burdened with too many patients, too many hassles, and that may not be ideally. Slowly should scatter down and get the facilities into tiers and small
And
towns
it will
also.
be easy also, like for
Yes,
diagnosis and
yes,
treatment
yes,
procedures also, it
absolutely.
will be
Yeah,
easy.
yeah.
Yeah. So what message do you want to give for normal, like podcast viewers regarding cancer?
See, cancer is just like a disease, and slowly with these immunotherapies, with targeted radiations and keyhole surgery kind, we are trying to make it a chronic disease like diabetes, like hypertension. So no need to get scared of cancer anymore. It is just like a disease, treat it appropriately, and all disease, including diabetes and hypertension, have failures, like cancer as well. But if you're treated appropriately and trying to do in a best practice approach, we will be able to control the disease as best as possible.
The early detection and diagnosis, then treatment planning is more
Yes,
important.
yes. See, someone have symptoms should go to the doctor early, get it diagnosed. See, if people are scared to do a biopsy or FNAC, it does not help. If it is inconclusive, if it is negative, we are very happy. But if you are positive, we should go in and get the treatment done. So if someone is having a symptom, go to the doctor, get the treatment done or assessment done, and that is the best chance of treating early and treat appropriately.
To get a biopsy done, also generally, people have a myth or fact you have to tell us,
Yes, yes.
because even with biopsy, they think that it will spread again.
See, uh, with biopsy, it does not spread. So, unfortunately, before it, see, a lesion more than 1 centimeter, there's already a metastasis outside, and it has been proven. But our body takes care of these cancer cells which has been in the system. So biopsy is not going to do any harm. But if we are not able to diagnose early, we cannot treat the burden of the disease which is there, and we will delay the treatment, and then the treatment will be more expensive, more extensive. Costs, the side effects are going to be more, and outcome will be less. But early detection is going to give a smaller treatment, outcome better, and complications are much lesser.
So, what is the role of tertiary cancer centers like Yashoda?
Yashoda. See, many patients need very high-end treatment to have a good control, good quality of life, and improve the outcome as well. That is where the MR-Linac kind or robotic surgery, bone marrow transplant things is required. It cannot be there in every places. There has to be a tertiary centers, and not all patients require this high-end treatment. But those patients require, we should have a facility so that they can avail this treatment. That is where the tertiary cancer center comes into the picture. So mostly for standard treatment should be done in small towns, cities, all places. Those patients need a very specialized kind of treatment, should approach the tertiary cancer center and get the best available treatment possible. So this is a triage kind. So those only those patients who need and will be useful to be treated with such a high end, like bone marrow transplant or immunotherapies or MR-Linac kind. So that is going to give the best triage. And once you do that, then in all phases, patients are going to be treated as they should, and the outcome will be as good as
Beautiful,
Western populations. Yeah.
So, what hope do you have, like in further cancer treatments and advancements and all?
See, one good thing has happened with the human genome sequence. We are now sequencing our genome, so we are able to find out which are the mutations, and hopefully in near future we're able to find out the cause of cancer and try to correct it. So there will be gene therapies, there is a human genome sequencing, and based on human genome sequencing treatment, and that is going to change the way we treat cancers now. I hope that the future is very bright for cancer, and we will get a solution like we have done it in for diabetes, hypertension. We have done it for CML. On blood cancer, we have able to find out and able to cure. And more slowly, all of the cancers are going to go into the same direction.
So, thank you so much, sir, for
Thank
sharing your knowledge and time with us. Thank you so much.
Thank you.